Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome to another episode of the Wellness Optimizing Warrior MD podcast. And I realized last month, August of 2025, has been 2 years since the podcast was launched. I have been pretty faithful, with a few exceptions due to travel, vacation, holidays, maybe being too crazy busy at the practice, with no time to record. I have been pretty consistent, try to drop one episode every week for the past 2 years. So thank you for being there every week and listening. I'm sorry I skipped a week here and there, like I did last week, as there was no time to record. So the topic of today's episode is actually about the value of estrogen. And it's a little bit of a different spin to it, so bear with me, because last week 2 things happened that made me realize women are not told and they're not explained the value estrogen has for their bodies. So the first thing that happened was a first-time consultation with a lovely new patient who, at the age of 60 plus, after never having to use hormones because she believed she didn't need them, she listened to a podcast episode with a panel of physicians advocating for hormone therapy after menopause. And after listening to the episode and what the physicians in that podcast had to say, she finally realized it is time for her to take action and improve her health. So she heard something that validated the way she was feeling was actually related to the estrogen loss, and now she wanted to act on it. She was very honest about her main reasons for wanting to consider a hormone therapy more than 10 years after menopause. And those were basically the skin was changing. She noticed aging signs that she didn't like. Her appearance on the outside was incongruent with how she felt inside. She also, one of the top reasons, wasn't able to be intimate with her darling husband of many years because of very painful intimacy, and because she associated intimacy with pain, and perhaps because her sex hormones were very low to non-existent, she had zero interest in being intimate. I hear this type of story time again and again about how the husband is very patient and understanding around this issue of impossible intimacy, and the relationship is either continuing and the marriage is still loving and supportive, but with the husband having to give up this part of their relationship. For some couples, the intimacy is completely gone. For others, it continues and it has to be adapted to non-intercourse intimacy, which is a very valid thing and exists. And for some couples, it leads to dissolution of the couple. Obviously, the intimacy loss for this specific patient had been going on for 3 years or more, but the rest of her issues just crept up on her gradually over the time span of the past 5 years or more. And again, this was very interesting because she was the kind of patient who was very fit. She was involved in healthy exercise regularly, if not daily. She maintained a positive, optimistic outlook on life. She avoided going to the doctor because she had been disappointed by our healthcare system and how she was treated in the past for other health issues. She found relief in the past with alternative practitioners and therapists like a naturopath. She avoided medications and prefer to use natural supplements if possible. And many women are in this scenario, right? They do the best they can with their health. They eat healthy. They exercise regularly. They do not want to take medications. They are as holistic as possible. Now, I don't specifically remember how exactly she found me, but I know she had already listened to a few of my podcast episodes. And what I have to say aligned with her vision of her future care. So she came to me asking for help. This specific woman and many others that come to me on a daily basis did not understand until somehow she made the connection between how she feels now and the loss of estrogen in the past 10 years. And obviously something brought it to the forefront of her mind and of her thinking. And she finally made the connection. Okay, I am here and I feel this way because I haven't had any estrogen in the past 10 years. Now, the second thing that happened that triggered the need to record this podcast about the value of estrogen, it's actually a series. I'm going to have to split it in a few episodes because there's so much to talk about, is the fact that last week I lost my first tooth. I'm approaching 60. I'm 58 going on 59. I have seen my mother with barely any teeth left at the age of 80 and in need of dentures. And I'm not at all vain about my teeth. And I remember I tried to do the whitening trays one time in my life when I was in my late 30s. I hated every moment of it. So I'm brushing, flossing, using the water pick, going to the dentist regularly. I don't really care about the appearance of my teeth. I mean, how pretty they are. I was blessed with reasonably straight teeth and even teeth. And I stopped smoking. Yes, I did used to smoke in Europe. I stopped smoking at an early age. So my teeth are reasonably white. But what I care about a lot is functionality. My teeth are very important to me. So you're going to say, okay, lady, what's the connection between the value of estrogen and your teeth? It's coming. As it turns out, I have a passion for chewing bones and peanut brittle as well as nuts, a lot of hard things. I vaguely remember about 3 or 4 years ago, maybe even 5 years ago, something happened. Maybe in the fall of 2020, I was chewing something hard. There was a crack and a snap. It felt weird, but there was no pain. I remember going to have my teeth cleaned. After the teeth cleaning, it started to bother me. Long story short, turns out I fractured one of my right upper molars, and I fractured it severely, beyond any salvage. It did not cause pain, and as I said, since I floss, brush, and use the water pick pretty regularly, I did not pay much attention to just a little bothersome sensation there. The dentist said it was fine. She sent me to a orthodontist who said it's fine. I always knew there was something going on. I was told it was my periodontal pockets, so I kept it super clean, did dental cleanings every 3 to 4 months as recommended. However, last month I noticed something sharp with my tongue. I saw the dentist immediately. He was smart enough to order a CT, found a huge fracture in one of the major roots of that specific tooth. Apparently, our teeth have either 2 or 3 roots, and my tooth had 3 roots. The third root is called the palatal root and is the main stabilizing feeding root of that tooth, and that's the one I fractured. So once the diagnosis was made, my own personal dentist and the 2 specialists I saw, who, by the way, neither of them took my dental insurance. They didn't take any insurance whatsoever. Had to pay out of pocket for the consultations, but I didn't bat an eyelid. I wanted to know what the heck is going on. Can I save my tooth? All 3 recommended tooth extraction, implant, and a crown later. Now, I don't know about you, but unless I have to, I'm really wary of anything foreign coming into my body. I do understand the value of my ACL ligaments. So when I needed ACL repair, I did not bat an eyelid when I was told, hey, you need an ACL graft. There need to be screws to anchor the ligament graft into my bones. I'm like, okay, well, let's get it going. Got all my ACLs back. I did fight to save my tooth. But once I was explained and once I understood what happened and what I was dealing with, I accepted the only viable solution, which was remove my tooth and plan for an implant. As it turns out, because I had no pain, obviously, because I kept my teeth clean, the infection that affected the bone had actually caused bone loss around my tooth. All of that could drain, did not form an abscess, and the lack of pain made me very hesitant to trust the fact that my tooth was beyond redemption. Just like the patient that I explained earlier was a new consultation and she didn't understand the value of estrogen until she had an aha moment, I personally refused to believe that there were 0 solutions other than a tooth extraction and an implant. And I persisted. I saw a bunch of other dentists. I talked to my own dentist. I explained and I had a conversation with him about other possible options. I really refused to believe there were 0 solutions. It didn't bother me. So if it didn't bother me, how could I suddenly go from I have all my teeth to losing 1 tooth? It did not take me more than 2 weeks to make my decision and to proceed with the treatment plan with extraction and implant. By the way, my dentist was awesome. He scheduled me for the procedure quickly. had the exact breakdown of the cost, what insurance covers, what it didn't, how to plan the next step until I have a full tooth again. Now, in case you're wondering, the procedure went great. At the end, he had to clean up the infected bone, place some matrix to allow my bone to regrow and reform on that matrix so the implant can go into solid anchoring bone. That's not going to happen for at least 3 months. I have to have another CT to look at my implantation side. Now, here's the thing. As I said, I value my teeth, and I hope you value your teeth as well. And I value mine enormously because I understand the value of my teeth and how they keep me alive and strong. I'm a carnivore, even though periodically I try to do vegetarian meals to give my body a break from meat. And I enjoy nothing more than an excellent ribeye steak with bone in, grilled by my husband with home-baked fries and asparagus. I love meat. Now, imagine I don't have teeth to chew my meat, right? I don't have to do research. I know what happens if I did not have healthy teeth. Number one, I wouldn't be able to chew my food the way it meant to be chewed in order to be processed by the digestive tract, which would impact many things. A cascade of serious events triggered by one small thing, chewing. Number two, I have seen my mom at 80 and how her lower face looks without teeth and how it looks with the dentures in place. Her facial structure is completely changed. Her face kind of like caves in without the teeth. So we need the teeth for facial structure and to look our normal self. Number three, we need our teeth because we need to speak. It impacts our speech. Now, I speak a lot, and I can tell you that even with one missing tooth, my husband complained in the first couple of days after the procedure. There was some swelling, obviously. He couldn't understand some of the things I said. So we need our teeth to speak. And if you didn't know that, well, you just found out today on this podcast. But last but not least, how about our confidence? Think about how your smile would look if you had a few missing teeth, crooked teeth or no teeth. Now, I have used the healing peptide 2 years ago when I had my knee surgery, and the surgeon told me there was a 50% chance to lose my meniscus, and the repair of the huge meniscus fracture I had could possibly fail, mainly because he said meniscus doesn't heal well, especially when you're older. And he was right. The risk was high not to heal. But guess what? I proved him wrong. And even though the peptide was taken orally in a capsule form, not IV, not injected in my knee, it still worked really well. I healed my meniscus. I did all the rehab 1 year after my surgery, went back to yoga. By the way, last month, August 1st, was the anniversary of 2 years from my meniscus surgery repair. Now, obviously, the first thing I did when I found out about my tooth was broken, and I wanted to salvage it. It was to do some research and see if there's any evidence that the healing peptide, which, by the way, also healed a nasty burn on my hand in 10 days in August of 2025, whether this peptide could actually help heal my tooth. So before I gave up and decided I'm going to agree to a dental extraction, bone grafting, blah, 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 I asked the doctor, the dentist, if he could inject it at the root of my tooth, and can we have any hope of the tooth healing? He did explain your tooth is fractured. A fractured tooth is almost impossible to heal. It's a bone-like structure, doesn't have a lot of vascularity. There's no way your body can put it together on its own. But what was worse, and this is what he pointed out, and this was the deciding factor for me, was that the bone loss around the tooth was significant. And he showed it to me on the X-ray and the CT. If I had waited, let's say 6 months or 1 year to see if I can heal my tooth with the magic healing peptide, it would likely not work, would lead to more bone loss, maybe to the point where a dental implant might not even be feasible. Now, the risk of loss of complete and total function in one area of my body, like one tooth, prompted me to make a significant decision to act and take action. So you might wonder, what is this story have in common with the other patient's story? Well, I waited 2 weeks to make my decision. It was a drastic decision. I had to take drastic action. But this patient of mine and many others, she waited 10 years to make her decision. Why? Because my patient and many others like her did not see the value of estrogen until she had her symptoms and what she felt validated by a huge panel of doctors. she had to listen multiple times and hear multiple people tell her the same thing until her own inner thoughts and feelings were validated. She finally became emboldened to make a decision she could have possibly made 10 years ago. I deeply and seriously understood the meaning of the possibility of permanent loss, the possibility of losing complete and total function in that area of my body, and going beyond what modern dentistry had to offer by delaying treatment further and losing the possibility of having a tooth forever. It was not difficult at all to make my decision to jump into action. Obviously, I could have waited longer. I had no pain. Nothing bothered me except the tip of the fractured tooth fragment was sticking out under the gum line, which, again, I likely caused that by eating pistachios the day prior to the fractured tooth fragment displacing and sticking outside the gum. Again, everything happens for a reason. And obviously, my decision to eat pistachios triggered all this. So thank you, pistachios. But the point I'm trying to make is many women choose to wait until the point of complete and total loss of something dear to them, like intimacy with their partner, leading to the possible dissolution of that relationship, or severe osteoporosis with risk of fracture, or serious weight gain and subsequent high blood pressure, severe fatigue, or serious weight gain with subsequent blood pressure, high cholesterol, cardiovascular disease, and other issues. Maybe they wait until severe fatigue is something they can't bear any longer. Or maybe they wait until severe depression or severe anxiety that doesn't respond to medication forces them to take action. Now, my lovely patient, and many like her, who wish to remain holistic in her approach to menopause, as a great majority of women do, did not realize until she had this aha moment what she had truly lost when she lost her estrogen. And this is what many women do not know. This patient of mine is not alone. Many women wait and wait and wait. They only take action when they cannot wait anymore because they do not know, they do not understand, and it's not their fault. They are not told the value of what they are losing when they enter menopause. And this is what this episode series is about. So I know I got to this topic by taking this huge detour, but again, I was trying to make my point about how women are literally not understanding the value of what they lose when they enter menopause. And they are literally not equipped to make the possible best decision for their health because there's such a serious lack of information about estrogen and about what estrogen actually does for a woman and how a woman's body will irreversibly change without estrogen. And many women, if not all women, are not told and they're not provided information about the estrogen value for their bodies. They are only told by their doctors, by their family, by their friends of how bad estrogen is for them after menopause. They're not informed at all regarding the value of what is lost when they enter menopause. Because believe me, estrogen has value. Now, I have preached about the value of estrogen and the other two hormones, progesterone, testosterone, many episodes on this specific podcast in the 100 plus episodes that I released. Obviously, I'm not the only doctor doing it. There are many doctors preaching what I preach, practicing the medicine I practice. There are very few, though, within a 60-mile radius within the area that I'm in that support hormone therapy for menopause and offer as many options as I offer my patients, which puts me in a little bit of a unique position of having the responsibility to share everything I know as much as possible with the world and with the women that need to know this information. Now, I have personally seen the light when I was shown the truth about hormones and the value of hormone therapy. And so did all the other doctors who are practicing hormone therapy after menopause. They were shown the truth, they understood, and after they understood, they learned and they started applying into practice what they learned. When doctors are trained in hormone therapy for menopausal and postmenopause women, they are trained by hormone specialists. Hormone specialists are doctors who train other doctors. They are doctors who perhaps practice very little medicine because they're dedicated to, for the remainder of their careers, to teach others. to look at the research, to look at the newest data, and come to the speaking podium of a class, a symposium, a fellowship, a webinar, online masterclass, whatever it is, with the newest and most up-to-date information in a format that's easy to assimilate for that specific type of presentation, whether it's a 1 hour, a full day, a 3-day, or a 2-year training. Now, I don't consider myself a specialist in hormone therapy in the sense that I mentioned before. I don't dedicate my life to research. I do try to stay with the most up-to-date information. But what I believe I'm a clinical specialist in hormone therapy, as I've been using hormone replacement therapy in my OBGYN practice since 2001 when I graduated my residency program. And I had to deal with many women who were told to transition out of their hormone therapy at that time. I discovered bioidentical therapy in 2010 and later pellet therapy in 2014. Now, I do have significant additional training beyond what my medical school, my 2 residency OBGYN programs, and the annual women health conferences that I go to have provided and taught me. I completed and attended the bioidentical 3-day symposium a few times with A4M, American Academy of Anti-Aging. I completed a fellowship in anti-aging and restorative medicine, which lasted just about 2 years, if not more. It was all online. Some of the modules were in person in Vegas, but it allowed advanced training in endocrinology, including sex hormone therapy, thyroid and adrenal dysfunction. I trained with Dr. Tutera, the pioneer of pellet therapy in the U.S. I trained with him in 2014 and again in 2015, and I trained again in pellet therapy with BioT in 2023. Now, all this information is available on my website as far as my credentials, but many doctors do not list their credentials, and many women do not ask and do not understand whether it matters or not. I do believe there's a huge knowledge gap, and women are not asking their doctors enough questions. Maybe they ask no questions about the background in hormone therapy education. They simply accept what the doctor says, and they pretty much decide to work with a specific physician to improve their hormones, obviously to replace their hormones when they're no longer producing own hormones. Most of the time, 90% or more, based on someone else's recommendation. And usually that's based on their positive experience, whether it's a friend with a positive experience, a family member, an acquaintance, or a colleague who says, hey, this doctor helped me, why don't you go see her or see him? Now, unfortunately, many physicians practice hormone therapy because it is a sure way to bring in cash revenue to their medical practice. And I'm not talking about just the hormone therapy and the consultations, which many women pay out of pocket, because managing hormone therapy is expensive to learn and to maintain into practice. But on top of the consultations, please know that many women have to pay the cost of the actual therapy. Because in many cases, women choose bioidentical compounded hormone therapy or pellet therapy. Neither one of these are FDA approved or covered by insurance. I have seen patients who had paid anywhere from $2,000 to $4,000 a year to other physicians to manage their hormones. It is called a VIP menopause, VIP concierge cost, charged per year to give that patient, that woman, access to someone who can answer their questions on a regular basis and help them manage hormones, complications, side effects, or unexpected circumstances. Now, I do believe many doctors who practice hormone therapy for postmenopausal women are too expensive and unaffordable. Obviously, if your insurance premium is over $1,000 a month, that's $12,000 a year. On top of that, you have to pay another $2,000, $3,000, or $4,000 to someone to help you manage your hormones. I would say that's a lot of money. Now, I want to come back next week and continue the discussion on this topic. Sorry, I got a little diluted with this. But believe me, I'm coming back to talk about the value of estrogen, why women are left in the dark and not being told about the value of estrogen for a woman's body, mind, and spirit. So join me next week as I continue this series. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas So please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.